Well, good evening, Abilene. Some of you, most of you, hopefully watched the governor's press conference earlier today. Stanley Smith, our city attorney, just provided kind of some notes that I wanted you to be able to know in regards to what exactly that means for us here in Abilene. And so I'm going to read directly from what Attorney Smith has provided me and maybe provide some clarity. So I'm going to start at the very top. And first of all, this really, before, I think the governor has been accused of being ambiguous and not being very clear. Today, there was no ambiguity in what the governor communicated. And what he communicated is that he wants to dictate how we open up in Texas. And having said that, and I'm still in conversation with city manager, city attorney, I don't want to waste our neighbors' time. And so I don't think that at this point there's a need for us to continue with conversations with our committee because the governor has really communicated how we're going to operate. I'll give you some numbers before we get started. The whole purpose of why we wanted the whole purpose of why the president as well as the governor wanted a shelter in place is really to be sure that our hospitals were not overwhelmed. One thing that's been talked about is that a certain percentage of us are going to be infected regardless. And the thought process was that we didn't want that infections to occur within 4 months, but rather 18 months. At 4 months, it would have been a situation where it could have overwhelmed our healthcare system. And so the whole shelter in place model was designed to exaggerate that and push out that, and we've been successful. So today, if you look at Abilene Regional and you look at Hendricks, as of yesterday, there were a total of 8 who had COVID-19 that were hospitalized. So a total of 8. And this was as of yesterday morning. You had 3 who were in ICU at Hendrick and 1 at Abilene Regional. I didn't get any kind of information about any more admitted to the hospital. So we have been successful, and West Texas has been successful too. I think that San Angelo doesn't have anyone in hospital now with COVID-19. And I know that there are less than 10 in the cities of both Midland and Odessa. Believe there is less than 20 in the cities of Lubbock and Amarillo. We do have a increase in infections. Then you look at the numbers; they have been significant. And having said that, Abilene has tested over 2,200 of our citizens. If you look at Ector County, that's where Odessa is, they have a population in that county of around 165,000. Compared to 136,000, and I believe they have tested around 1,100. Midland, who has a larger county also, I think they tested about 1,200. And so Abilene and Lubbock per capita have been very, very aggressive. And so the virus is out there. And so when we realize that there are more than 255 people infected in Abilene, in fact, the experts say that it could be between 5,000 and 7,500 who are currently infected as we speak or were infected. Just know what that looks like. And I want to give you some feedback in that regard. And our firemen, so Candy Flores does an outstanding job as our fire chief, and our fire department was not they were not situations, they didn't take it seriously. But we are testing. I think there are around 1,400 policemen in New York City that were tested early on. And so the virus is in our community, and our first responders certainly are the ones that are at risk. And so mindful of them. I'm going to read my Cliff Notes version of the governor's order to provide some clarity to you, and I'll make some comments towards the end. Every person, and this is a summary, and I can provide for you, or you can go to the governor's website and look at his order. But I also provide, if you want, kind of my Cliff Notes version of what that order says. Of course, this was done by our city attorney, Stanley Smith. Every person in Texas shall accept, where necessary, to provide or obtain essential services or reopen services, minimize social gatherings, and minimize in-person contact with people who are not in the same household. That's same as before. Persons over 65 are only encouraged but not required to stay at home as much as possible. Number 2, essential businesses as determined by the U.S. Department of Homeland Security remain the same as before. Different. Effective this Friday, that's May the 1st, the following applies to reopen 9 essential services. In-store retail services is allowed, but businesses may only allow customers into their stores at any one time of 25% of their total listed capacity. Dine-in restaurant services is allowed, but only for restaurants that have less than 51% of their gross receipts from sales of alcoholic beverages. Also, the restaurants may only allow customers into their restaurants at any one time of 25% of their total listed capacity. Valet service is not allowed except for persons with disabilities. C, under the new order effective Friday, restaurants that have 51% or more gross receipts from the sale of alcohol may continue to provide service or drive-in through pickup or delivery options. That's the same as before. D, movie theaters may operate, but may only allow customers into each individual theater up 25% of that theater's total capacity for any screening. Shopping malls may allow customers into the mall up to 25% of the total capacity of the mall. However, food court areas, play areas, and interactive displays and settings must remain closed. Museums and libraries may allow customers up to 25% of the total capacity of the museum or library. However, public museums and libraries may only operate if allowed by the local government. And we'll talk about that in just a bit. Interactive functions or exhibits of child play areas must remain closed. G, under those opening this Friday, May the 1st, services provided by an individual working alone in an office is allowed. Golf courses are open. Local government operations may open as determined by the local government. Now, number 4, religious services are allowed in accordance with guidance provided by the Attorney General, and the Governor designates separate areas for at-risk persons to participate remotely, 2 empty seats, or 6-foot separation between persons not in the same household, and skip every other row. Number 5, effective immediately, the following businesses and services are closed: bars, gyms, public swimming pools, interactive amusement venues such as bowling alleys and video arcades, massage establishments, tattoo studios, piercing studios, and hair salons, nail salons, and tanning salons. Number 6, people are not prohibited from accessing essential services or reopen services or engage in essential daily activities, visiting parks, hunting or fishing, engaging in physical activities like jogging, bicycling, or other outdoor sports, so long as the engaged in social distancing is minimized in a person contact with people who are not in the same household. 7, people may not visit nursing homes, state support living centers, assisted living centers, or long-term care facilities. 8, schools remain closed to in-person class attendance for duration of the school year. I'll mention schools in a bit also. People are encouraged to wear masks, but not required to do so, and local officials may not require persons to wear masks. I'll read that one more time for clarity. People are encouraged to wear masks, but are not required to do so, and local officials may not require persons to wear masks. 10, local officials may not restrict essential businesses or reopen services, may not allow gatherings prohibited, and may not expand the list of essential services or the list of scope of reopened services. And so the city manager and his staff, along with the council, will have some conversation about what do we do with city services. And so that is still, since we just heard about the governor's order this afternoon, there'll be conversations that will occur in the next few days, and we'll let you know. Schools, David Young was going to join me today because of I want to spend more time talking to you about the order. He will not, but we plan to come before you in this same venue and talk about schools. There are 4 different models that are being discussed in regards to schools next year, and I think you should know about some of those things. And of course, at this point, it's all based on best guesses, as best on hypotheses of how they think this virus is going to act. But we wanted an opportunity for you to be able to hear from David Young. And so I will continue, and we'll continue to provide numbers. You know, we're at 255 today in regards to infections. We've had 3 of our neighbors who have passed. We have 8 who are in the hospital as we speak, 7 at Hendrick and 1 Abilene Regional. That number has been on the decline. We have been successful in social distancing in trying to flatten the curve. Again, what the experts say is you can't prevent these infections. The whole idea around shelter in place was, rather than having infections of 25% of our population in 4 months that would overwhelm our health system, to exaggerate that and make that more manageable over 18 months. Abilene has been very, very aggressive. We have administered over 2,200 tests. There is no other West Texas city that's our size that's been as aggressive as Abilene. And we want to continue to do that. And some of the test results by private labs, because they're required to report positives, but not necessarily negatives. And so we've at least had 2,200 tests. And so I'll be back before you. We'll get more clarity. Keep praying for our city, and pray for Candy Flores and all those men and women who serve with him, and pray for everybody that's been infected. Thank you, and God bless you, and may God continue to bless Abilene, Texas.